we increase the quantity of milk, volume of milk, what we give each feed from 0.5 ml based on their weight. We increase like 5 to 10 ml or 20 ml based on their response to reach a full feed. We call it as 150 to 180 ml or 200 ml per kg per day, depending on their weight and how they respond. So we have to reach that as early as possible. It could be 2 days, it could be 3 days. Most of them do achieve within a week time max. From birth till week, we would achieve if there are no complications. Once we start a feed, usually we see a problem of feeding intolerance and NEC at third and fourth week of, once we have started the feeds. That is a time when we are already, baby is accepting feeds for 3 weeks, and then we are confused when they are in early stages of feeding intolerance or early stages of NEC. That is necrotizing enterocolitis, where the intestine blood circulation comes down or inflammation gets triggered, which will lead to less supply and which will lead to thickening initially, then thinning, and then perforation of the small intestine. So this entire inflammatory process typically we see on third and fourth week of starting the feeds, because that is a time when our point of care ultrasound will help us and give a live feed of what is happening in inside the tummy. And the old method of depending on X-ray is an absolute now, because this gives more information so that chances of them going or worsening can be prevented if you act early. So in babies, it's always you act and then you think later. So in adults, you think and then you act later. So in babies, they don't give much time. When they go bad really. So that's why when baby is in first step, we try to anticipate the next 9-10 steps so that we are prepared. And we'll be very aggressive in terms of addressing any of the problems which they face. So in NEC, starting feeds early is important. Achieving full feeds is important. At the same time, we need to look at whether after achieving full feeds, whether baby is able to tolerate that particular feeds, or is baby developing any sort of intolerance or signs of necrotizing enterocolitis or any what we call, or NEC, what we call, and whether baby has developed other complications because of the long duration stay in the NICU, infection has got triggered this. We have to look at every aspect. So, but nutrition, when we stop feed, we should be aggressive in restarting feed at the earliest whenever that happens, even whether it's in the morning, evening, or night. If we have a chance to restart feed, we have to start, because at the end of the day, we want baby to survive on milk, not on IV fluids. So this is the whole journey of how we handle. And definitely the earlier days, how things were handled for NEC, now it has changed drastically with the advent of, with the technology coming in. So NAC handling is far better now, because we'll be able to see everything live feed with our ultrasound, and just put a probe, we'll get to know what is happening in brain, what is happening in heart, what is happening in tummy. Even if there is some infection, hip also we just check and see, spine can be checked. Literally, even if you're finding it difficult to put a cannula, whether to check whether the lines are in place, ultrasound makes a huge impact. With this technology coming in, the complications, what we were observing earlier 10-15 years back, now it has reduced very minimal. That's why the survival of 26 weeks, and the moment gynecologists say that baby is 28 weeks and above, we know that babies will be fine, unless there is some comorbids. Even now, it has reduced to 26 weeks. The lowest what we have survived in our center was 23.5 weeks. It was a twin with a birth weight of 430 grams. Baby is still coming, follow up with us. Baby is doing fine. IQ, but initial 2 years, it took some time for the physical development, gross motor development. But fine motor, language, everything picked up. And baby is doing good. Now baby is almost 4 or 5 years now.
So that's a great achievement.
not only here, there are a lot of places across India, all the places, all major places, they are doing very good in terms of preterm care, because we have so much of technology, so much of support what we're getting from nursing staff, from our team members, and even
I know it's so challenging also, no?
Yeah,
it's so challenging also to bring out such kind of babies, and pull them, and if they're doing good neurodevelopmentally wise also, then it's really good.
And even the mortality in most of the hospitals, in our hospital, if you take, it is less than 0.5%. I'm not exaggerating. Maybe we don't see death at all, because things have changed that major, because of the technology, because of the monitoring, because of antenatal scans, because of good care. Premature babies are expected, not like they come unexpected. Because
Exactly.
when they come, we know that why, whether it could be because of any of the maternal factors. We will know early that why this is happening. So this has helped us in taking care of premature at a next level, so that they are, the whole concept of intact survival, they are pushing over there.
But thank you, sir. I think with feed intolerance, what we learned is the practice of UST, as you mentioned, which is live and also quick to diagnose. And making sure there's no feed intolerance is also very important. And so now understanding, like, the breast milk, like importance, as you mentioned, I want to ask Dr. Snehal, how do you make sure that, because now most of the mothers hyperlactate and they are not able to feed. And what is your view with respect to the donation of the milk, and what are the tips you can, to let the mothers know that they can make sure there is surplus demand of milk without the baby, demanding happening? Over to you, ma'am. Ma'am, can you hear us? Okay. Yes, ma'am, you're audible. Please go ahead. Yes, you're audible. Yes, you're audible. Please go ahead.
Problem.
That's okay.
Problem
Yeah.
from hyperlactation, and they end up with mastitis if it is not periodically. So I have seen many mothers, they have hyperlactation like on the supply. So those mothers and in ICU babies can get benefit with the human donation, like with the proper knowledge of storage, proper milk handling techniques, able to donate the and this because they are concerned that they can save the tiny lives in an ICU. Babies will be provided with a donor mother. So definitely, I would advise most of the mothers who are having treatment, they should not or
Ma'am, sorry to interrupt. There's a lot of background noises happening. That's okay. With the time constraint, let's. Yeah, now you're audible. Yes, ma'am. Please go ahead.
So I would definitely nutrition. You can survive tiny lives. You can definitely enjoy the real joy of motherhood. Yes. And regarding the stories, expressed breast milk can be stored 4 to 5 hours in temperature at 25 to 28 degrees. If she wants to store further, she can store 4 degrees at 4 to 6, 8 degrees centigrade in fridge. Or if she wants to store further, she can store in freezer for about 9 days. And each drop counts. If a mother is feeling she is having a lot of them, she can definitely directly go for frozen. She can provide that. So by that way, she maybe to uh, babies are trying. They are not having mother.
Yeah. Thank you, ma'am. So mainly it is the hand expression of the milk and making sure it is stored at appropriate temperature and then used. Now, just not the question for sister, for you. Handling these babies, what is like you have to make sure you feed them on time. The frequency is more, and you have to pay attention. What is the number of preterm babies you handle, or make sure that proper care is given for each preterm.
Actually, in NICU, if that is feeder grower, it's called only the babies having feeding the issue. Only the babies will be getting the oral supplement. Then the nurse we will be allocate one person for two babies, because as proper attention and care is required for the preterm infants. That is the reason we are allocating like that. If it is ventilator case, one person, one ventilator baby will be assigning.
So you're making sure. And what is the most common questions you face from the parents? Because every parent would say, I want to see the baby, how is she doing? And what are the precautions you would take while handling the baby and also when a parent enters the NICU?
Yeah, it's a common question. Every day we are facing the challenges actually. Uh, Initially, we will be explaining like counseling time is very restricted for the parents, first of all. So also the hand hygiene, everything we will be before itself we will be informing to the parents, because as everyone knows, sepsis is the danger for all the preterms who are staying inside the NICU. So we will be make sure and awareness will be giving to the parents so that they will be also aware of it. So whenever the mother wants to come, we are not restricting the mother. Mother can be come anytime. Only the father we will be restricting. Apart from the KFC, we are giving concur of father care also in our unit. So we are encouraging, but or the same way we will be telling the mother that if the mother is staying long time with the baby, like for example KMC, yeah, 6 to 8 hours the mother is giving for the KMC, the bonding will be developed and the stay will be less. This is the first point we will be telling to the mother, so that they will also involve and they will also whatever questions raise also they will be understanding in a concerned manner. So it is very easy to handle them. If first itself we are involving to them and saying that all the things, so that they will also cooperate with us. That is my experience actually.
Yeah, agreed. Agreed. And thank you for sharing the care taken. Now, before we, because of the time constraint, so we will extend it for another 5 minutes and also quickly end. So I to understand, like, if you could give us a quick message from your end and concerning the World Prematurity Day, what would be the key points or key message you would want to give? Ma'am, would like to start from you.
So, see, the thing is that every life matters and we want to save every life. So, this is first thing. Second thing is, I always want, so on this basis only, I want to say the patients that good antenatal care is must. You should, antenatally only the care begins. So, you should come and check out with your obstetrician, whosoever you are consulting. Go on time, take regular checkups, get regular testings done. Any kind of emergency signs and symptoms you feel, you should report immediately. Don't wait for late signs and symptoms to develop. Sometimes the patient, they get leaking at 26, 27 weeks. They keep on waiting at home. Oh, I don't have any pain. Might be it is just a normal sign. No, you need to consult your doctor before determining whether it is normal or abnormal. So it is the doctor who will decide what is good for you and what is not. And everyone wants to save preterm birth. We all try. But if it happens, then over to the neonatologists who are there to save the child. and we need very good hands. We need very good care. So you choose your center wisely, follow the advice, and just take care of yourself. Take good proper diet, proper nutrition, and do some exercises during pregnancy. Look for the risk factors if there are any, that obviously the doctor whom you are consulting will take into account. Do follow some home measures, but not only the home measures will help you out. So do follow our advice too. So that is what I want to give the message. Save every life, save every child, and be healthy, be happy.
Yeah, thank you, ma'am. That's a good. So, reaching out to your clinician is very important. So don't delay. So now the preterm baby is handed over to ma'am, is like delivered and it's in your unit. So what is the key message you would want to give for the parents, with respect to taking care of this preterm?
See, always, as Dr. Reema said, prevention is better than cure. And I would say, I would request and suggest all the parents that please stick to one doctor. So if somebody comes and brainwashes you that there is one Shah Rukh Khan waiting, go to him. There is one Salman Khan waiting, go to him. Don't end up with Nawazuddin, a villain. So stick to one doctor, stick to one place. Have a clear idea. Whatever doubts and queries you have, you clarify it. See whether it is a normal delivery or a C-section. It is not some high end of surgery, but whether to do or not to do, that is the most important thing, and when to do. So this is what which is key, that only the doctor whom you are following with, gynecologist whom you are following with, will be able to address. So have faith and confidence. 90% of the premature delivery can be prevented with the proper antenatal care. So focus, you end up with us inevitably, where again we will put back to gynecologists, and we say that if we would have appreciated your problems, whether it is cervical incompetence, infection, UTI, whatever might be the antenatal reason. So prevention is better than cure, and we pray, and we always say that premature delivery should not happen. In case if it happens, because of unavoidable circumstances, even with best follow-up and care, they might end up, because that is not under your control, or any of the doctor's control. In that situation, every premature babies can be taken care. We do have a lot of infrastructure, facilities, technology. As I said, in last 10 years, we don't allow any of the babies who are more than 26 weeks to die, or mortality is almost negligible in most of the hospitals, what we have seen in most of the cities. But when it comes, every premature baby, don't get tensed up. You openly discuss with your pediatric team or neonatal team all the pros and cons, and we will be able to tell you, looking at the present, the current situation of the baby, how they came out, how they behaved, what is their NSU course, what is expected, what are the complications we are looking at. See, because of the legal aspects, we do tell all the extreme things as well. But that is our responsibility to tell you, because of the to documentation, but that should not scare you. If you are getting any specific concerns, or if you're worried or scared, have an open discussion and discuss with them, discuss with the neonatal team. And now the present concept of NICU care is called as a integrated family-centered approach. So in abroad already, a mother, baby, mom, dad, and baby in one single room concept is already there. In India, because of financial constraints, we put NICU, babies in one single floor, 8 babies or 10 or 15 or 20 babies in one single floor. The family-centered care is yet to enter in India, but here we do involve them, because every day they come, they take update. Have patience, have positive hope, and we'll try to rectify from our end whatever baby needs corrections, or whatever support they need. Most important thing is have faith in doctors team who are treating your baby and mother, and there is no one to blame, because no doctor, no mother, no father, no obstetrician would want to any of the couple to suffer. If it happens, take it and face it boldly. Don't get scared. Every premature baby deserves a chance when they are viable, with when they come out with certain criteria we look at. If all those things are there, allow them to give them a chance to survive. Now even the insurance, few of the insurance are covering premature babies now. That's another good thing. So during pregnancy, when you're taking insurance, please do ask about premature baby cover. There are many companies now who have started providing insurance cover for premature baby. Preterm care is costly in present Indian scenario, because the ventilators what we use, the incubators what we use, those are all in many lakhs. So plan it well, your entire pregnancy, because when you're buying a car, you look at their interiors, leather cover, the color, the shape. You want this particular time, but when you're delivering a baby, prior to delivery, please do all your workup. You do talk to your gynecologist, exhibit faith and confidence. If you are not confident, you are free to go to any setup or any hospital. But once you stick to them, don't again exhibit not showing your confidence, because uh, the entire process of pregnancy, 9 months, is a very crucial phase, both for the couple and for the entire family. And when mothers become pregnant, the baby, always the beautiful soul, comes with a lot of dreams, hopes, and positiveness in the family. And when it comes to premature babies, your tension will be more, because they have coming prior. So you have to be all the more prepared, all the more focused, all the more strong from inside. So be strong, have faith, have trust, give a chance. Every baby deserves a chance. And prepare for the worst scenario, expect the best and prepare for the worst scenario. That's how we take care of premature babies. On this auspicious day, let all premature babies survive with intact growth, development, and let them become superstars, the forthcoming superstars. Let them become Virat Kohli. Let them become the finest celebrities and personalities. Let us all come together to bring their best potential by giving them the best possible support and care, both to the family and to the baby. Thank you.
Absolutely. Thank you, sir. You also answered the cost involved with all these, the treatment. It comes with the advances and the technologies and the treatment. So it's needed, like you act and you think later and also spend for the right thing and not for something fancy. Thank you. Thank you for putting this. So, sister, what would be now? Let's say there's a parent who's saying, like, just forcing and very tense. What is your message, and how would you convince that mother in terms of taking care of preterm? Very like a quick message from your end.
Yeah. Actually, as doctors been discussed, the same thing I also suggest for all the parents. Once the preterm happens, we should not think that yeah, it is happened. Happen is happened, but the thing is, we should accept this environment and we should adjust with the people. Also, the consultant, they should be trust. When they are believing them, then only things will happen go smooth. Whatever a daily base, they have to attend the counseling day on basis what is happening to their own baby, they should be knowing. Then only they can also involve their full thought, because many parents are fully afraid nowadays. We can see all the parents are like more questions. Even if you make them to stand, they cannot be move more than an hour, they will be standing for the question. But the thing is like, we practice that when counseling happening, the same time one nurse will be there who's on allocation person, so that once counseling time, they will attend the same counseling time, they will attend. Also they will come and ask the same question to other staffs. So then
Right.
we will be clear it. So this message can help all over India. The thing is like
Mhm.
everywhere the same messages everywhere, same treatment. All the gynecologists, all the neonatologists, well trained in the world. By God grace, nowadays preterm baby survivalence is more actually. Almost 12 years I am in, 10 years I am in Cloud9 only. I very less than 28 weeker, 24 weeker. Nowadays surveillance are there. They should be, awareness should be there for that. Then automatically trust will happen. Also, all the preterms are not same. They should understand
Yeah.
that. If they
Right.
understand, question will be very less and answer also will be easy to treat the babies, and counseling will be good for the parents. This is way I can
Yes.
also, may the Lord bless all the preterm. Sir already told everyone will be very intelligent. Also gynecology support and neonatologist supports are more, because whatever we are doing also, they are like through God gave them such a beautiful hands.
So
Through them they are surviving. That's the reason I'm just praising God every day, that all the babies should be survived.
thank you so much, sister. That's so sweet of you, and I'm sure even your efforts is put every day to make sure proper care is given for the preterm baby. Thank you so much. So, Dr. Snail, I know there are some technical, I mean, background noises, but still, if you could give us a quick message from your end as a lactation consultant, that would be great. Dr. Snail, you're there? Can you hear us? Okay. Okay, so let's be already beyond time, and I want to check if Mr. Vishal is online. So I'm not sure. We have a person here, but okay. So I think the parent has not joined, but it's okay. Let's make sure that we get a parent to understand the challenges what they faced, and I'm sure because in clinically you will face every parent, and you'll have to give your time and counseling. But thank you to all the panelists for your valuable time. This was such a great discussion where you covered the important needs starting from the birth, antenatal care, birth, and in the NICU, and also the care given by the lactation consultant and the nurse especially. And I'm sure now this will be very important for every mother who has a preterm. They are going to watch it and get some confidence that every baby is different, and it's not always that you can't there is 100% chance that you can make sure your baby survives. And like Sasa said, let's have some Virat Kohli and celebrities in future. And once again, thank you for joining the session, and thank you everyone who's watching the session. Let's continue our collective efforts to improve the care and outcome from premature babies. Wishing you all a meaningful one premature day. Thank you so much. Thank you, and have a great day
Thank
ahead.
you.
Thank you.
Thank you so
Thank
much.
you.
Thank you.
Thank you.
Thank you so much.